here with Dave Patterson. He is here with Gold Pediatric Orthopedics. I am Muriel Lee. I am here with Intensive Physical Therapy, and today we've asked Dave to come to our area to speak about orthotics. A lot of our parents don't know when to get into orthotics with their child. They see that they're not walking properly. They know that they need some help or support, but they don't know where to start. So we've asked Dave to speak to that issue today. Dave, tell us a little bit about Goal and how you guys got started.
Yeah, so Goal was started in 2019. It was started just by myself. I'd been in the field for about 6-7 years, and where I had specialized my residency and my work experience in the pediatric realm, which is pretty rare for our field. Our field is small in general, and then to specialize within that is, again, it's pretty rare. But I loved working with kids, didn't want to do anything other than that. And so I found a group out in Texas where I did my school that were 2 PTs that had become dual certified as orthotists. So they had gone back to school, and it was the most incredible training one could ask for, because I got to work under their tutelage, learn everything about the PT side, and then also incorporate, the orthotics, which is really, at the end of the day, an orthotist, in my opinion, provides tools for therapists and their patients. So to get that perspective was incredible, and such a good experience. And then, was with them for a while. I thought I was going to open a practice for them eventually, but they kind of went the corporate route. And I decided I didn't really want to go that route, so decided in 2018 to start my own thing.
Very nice.
That was, now 6 years ago, and we've grown a little bit since.
Yeah, you have. Hey, Dave walked into my clinic one day and he asked if he could do an open clinic, have some of his people come in and work with some of our children. I said yes. It's been the greatest companionship and merger together, if you would. I've loved the things that I've learned from him and his crew. It's been fantastic. So Dave, let's get into it.
Sure.
Talk to me about, a mom, they're seeing that their child is having difficulty walking, standing, they're not meeting their milestone. At what point would you say that a mother should really get involved with asking their doctor, hey, do I need orthotics for my child, or what do I need?
Totally. So everything is it's alignment based. Everything that we do, everything we treat alignment. Typically when kids aren't walking and it's more than a few months, if they get past that, 16 months or more, and they're, that's when the pediatrician often is going to refer them anyways to early intervention. And I think often pediatricians, and I've got 2 good friends, pediatricians, and I've asked them, what do you guys know about pronation and alignment? And they honestly, they defer to the early intervention team. When kids aren't hitting their milestones, they kind of refer out. And so if anything, I would recommend to parents, like if kids aren't hitting their milestones, to maybe push the doc for early intervention, because that's kind of like the first step.
So you said pronation. What does that mean? What does that look like? And what other things are you seeing that give the children some difficulty to stand and walk?
For sure. So when we're learning to walk, it's all about foundation. So when a kid gets placed in a standing position, whether they got themselves there or when the parent puts them there, what they feel is going to dictate kind of their future as far as what they're going to be able to do. And often kids, or the kids that we see, often that foundation is very compromised. Our foot, I often explain it to parents, and we'll often have them stand. So if you're watching this video, stand up for me and stand on one foot. This is silly, but I like to drill it home. If you stand on one foot, you'll have your heel and then the ball of your foot. And say this is my right foot, so that is my arch. You'll feel as you balance on one foot, your ability to pronate, and that's where the arch kind of collapses down and you go down on the inside, and then you'll supinate to the outside, and you'll make these little corrections back and forth. Well, a lot of our kids, their muscles and ligaments are too stretchy, is just a simple way to put it, that it allows them to over-pronate and to over-collapse to a point where they can't counter. And just as you experience balancing, you need to be able to counterbalance, to be able to feel safe and secure, to then take a step. Because then once you've established, stepping is actually balancing between one foot to the next. So I brought this little kind of creepy foot. It's not a real foot for those that can't tell. This is rubber. Anyways, so these kids, they'll look like this, where their arch will collapse and their pinky toe will almost be up in the air. And at that point, that foundation, you can imagine what that kid's brain is telling them is like, I ain't safe. And a lot of these kids, when parents go to put them down to stand, they literally lift up their legs. They're like, nope, I ain't doing that. Because they don't feel secure. And the message is, you're not safe, you're not secure. And those are often the kids that are developmentally delayed, is because of what's happening there. So that's kind of like the first place that I look at, is when kids come in and they're a delayed walker. It's like, well, let's just watch them weight bear, you know. So we'll have them pull the stand and just stand, and almost 99% of the time you just see a very compromised angle or foundation at their foot.
Excellent. So if I understand correctly, the first thing you want to do is get to your doctor and ask them to refer you or your child to early intervention. And from early intervention, they will be able to assess and see the needs that your child has for their standing and balancing. And then they can get in touch with an orthotist who they can make a prescription or a recommendation for the correct type of orthotic that your child needs to feel balanced. And then they can start walking.
Absolutely, yeah.
Okay.
So the PT at early intervention, if they meet those requirements of getting services, they'd be the ones kind of working with that kid and understanding, is this, because sometimes it's a diagnosis that no one ever knew about, and that therapist can kind of help guide that path to understand that there's a bigger thing going on. In other kids it's just idiopathic, meaning no true underlying cause, low tone pronation, and in those cases they'll often refer to us, where we'll kind of do a collaborative like we do with you, and we'll look at that kid together and determine, that they could really benefit from putting that foot into a position that they could really start to utilize much more efficiently.
Awesome. Well, hey, I think it's fantastic. As you're on your journey with your child that has special needs, or you feel that they need a little bit more support for their function, I want you to consider Gold Pediatric. They're fantastic to work with. They come to your home. They'll come to your physical therapy appointments. They'll do whatever it takes to take care of your needs of your child. They have a mobile unit that they go around with so they can make adjustments. I love the fact that if the straps break, anything happens to that orthotic, they will take care of it for you. Do you have anything that you want to add to the parents as they're contemplating maybe getting some orthotics or getting some help for their child?
The only thing I would say is, I think it's really important to note, in the studies and the research, they've shown a lot of correlation with motor to cognitive. And so a lot of parents are like, let's just wait, we'll see. And a lot of dads, and I'm one of them, you know, my kid, they'll walk, they'll eventually get there. And they do. A lot of kids eventually walk and get there, and maybe after 2. But now we're looking at a kid that not only is 6 months developmentally delayed with their motor skills, but because they haven't been exploring like their peers and doing all those things in those critical years, they often get behind in their cognitive as well. So there's a strong correlation there. And at the end of the day, to get kids up and going it's just a lot more fun. And one thing I want to emphasize just real quick, when we address the foot, we don't do devices to get kids to walk. We're addressing an orthopedic concern to try to guide that foot so that it has the best kind of future possible. And so we often really emphasize that with parents, like, because we've had those that they start walking within a few weeks of wearing our little braces, and then they throw them because they think they've reached their goal. And that's not necessarily the goal. That's just that's the cherry on top of good alignment. So those would be my few last little tidbits.
All right. Well, hey, continue your quest. Your children are precious to us. We want to see them succeed and excel in their lives. And so here at Intensive Physical Therapy, we do intensive therapy, but we have a team around us, and we're grateful for you, Dave, sharing your experience and your knowledge with us today. Thank you so much.